Thank you, Mayor. No one has worked harder or has been more involved in bringing this dream to a reality than Terry Dunning. Terry has served for almost a decade as chair of the board of Sherman Hospital. He's been on the board for many more years than that. Every organization needs a servant leader, someone who's totally dedicated, a person involved who is not only smart but gets the job done, and that describes Terry to a T. To share his reflections on this day, this great day for healthcare in our community, please help me welcome Terry Dunning.
What do I say after that? Well, I am Terry Dunning, and good evening, everyone. And on behalf of the Board of Directors of Sherman Hospital, welcome to your new Sherman Hospital. This is really, really wonderful. I've been asked to talk a little bit about the timeline and a little bit about the history of this project. And a lot of this is in your gala booklet, which you'll have an opportunity to read. But I'd like to tell you just a little bit about how we got to this point where we are tonight. In 2001, our board was looking at a group of plans to build two 10-story towers on our East Side campus. North Side neighbors weren't real happy with that. Our board wasn't real happy with that, I don't think. So we started talking about it, and we kind of laid aside those plans and decided to take a little further look. We spent quite a bit of time looking on the east side of Elgin for a new site to build a hospital. We looked downtown Elgin, we looked up on Route 31, and we looked on the west side. We already had a site on the west side, right across the street on the northwest corner. But along came this particular piece of property, and Jim Knowles and his family, who owned the property, was looking for something more than just a residential subdivision or a bunch of big boxes to go up. And when we approached the Knowles family with the idea of building a hospital campus here, they were delighted. And so it took us a little time to get the deal done, but we did get it done, and we were able to begin our plans to make a new Sherman Hospital on this particular campus. Some of the people that have been involved in this from the very beginning, when we rolled up our sleeves and went to work, we decided the first thing we really needed to do was hire a construction manager. We know a little bit about construction, but we don't know how to build hospitals. So we were very fortunate to have Bolt Construction, or Consulting rather, there's Bolt Construction and Bolt Consulting to help us with these plans from the very beginning. One of the first things we did, we interviewed architects, and the group of about 10 of us, including 4 members for the administration, 3 members of the board, and 2 physicians, made a tour around the country looking at hospitals the leading architects had built. We went to New Hampshire, we went to Kalamazoo, Michigan, we went to Utah, we went to Colorado, we went a lot of places. And I think one of the most enjoyable things that I found on this particular tour, and I said I wasn't going to mention any names, and this is the only name I will mention, but that is Charles Burnitz sitting on that airplane grilling all of the architects that we had along with us. And I think they found out pretty soon that we were pretty knowledgeable as far as the architectural field was concerned. So that was our first stop. The next thing was hiring one of those architects, and that was Shepley Bulfinch and Jonathan Gorey, who's been with this project right along, his whole team, along with Lobel Schlossman, which is their Chicago partner. They are the ones that designed this beautiful building, this tree of life, the elm tree that is so-called. This is the wonderful design that they put together. We had a little bump in the road along the way, as Ed said, but finally Walsh Construction came on board, and they hit the ground running. And they promised us they would have this hospital done by this time, and they have kept their promise. There's been a lot of pressure on them, but they've done it. They have done it, and our board and everyone really appreciates all the work and the dedication that they had in doing that. There's a lot of other people we need to acknowledge. Kaufman Hall, our financing arm, Morgan Stanley, and these people are here tonight, some of them. Our investment banker, McGuire Woods, our attorneys, Pat Schweitzer, our CON consultant, and Kathy Schaefer, public relations expert. And so very many members of this community, the mayors, the city council, the police chiefs, the fire chiefs, and the towns around the community who have come to speak for us, and all the people that spoke for us at our public hearing. Most important, as Rick mentioned, is the wonderful employees that we have working at the hospital. They have put a tremendous effort into making this hospital a reality. From the very beginning, we had a mock room built at the D.C. Cook building, and the nurses, the physicians went over there to see what they could do to make this hospital and the hospital beds, the hospital rooms, a little bit better. And they spent a lot of time on patient safety and patient healing. So we really owe a great deal to them. And then the transition team came along, and they spent hours. Many of the hours were on their time, not on the hospital's nickel, but on their time. So we're very, very grateful and dedicated to all of our employees from the top level down all the way down. And so it's been a wonderful, wonderful journey. It's not quite over. We've got 10 days to go. 10 days from today, December the 15th, the ambulance will be starting to move patients from the east side to the west side, and it's going to be a glorious, glorious journey, and we're ready for greater and greater health care in this community by Sherman Hospital. Thank you very much.